Within the last half an hour, the ATAGI advice has arrived with the Minister. They are an advisory group to the Federal Minister for Health, and that advice has been given just before we arrived here. As you know, we have had the ATAGI group has been meeting every week, reviewing all of the information that comes through the TGA and other mechanisms about any adverse events related to vaccines. And their advice has been based on the assessment of that new information that was given to them yesterday from the TGA. So that's 12 new cases of this rare but sometimes very serious clotting condition, the TTS syndrome as it's called, in the last week. And 7 of those have been between the age of 50 and 59. So that has changed the rate of that particular issue in that age group to the point where the rate is very similar to the under 50s. And so it's really that's been the key new information that has gone to ATAGI, and they've based that on the risk-benefit equation now being the risk outweighing the benefit in that particular age group. In the statement that they've given and will be published shortly, they go through that in some detail about why they've made that decision. They've balanced the risk and benefit of the vaccine in the context where we are right now in Australia in relation to the COVID-19 pandemic, and also with an eye to what might happen over the coming months. And I think that's a really important message. AstraZeneca remains a very effective vaccine. The benefit of AstraZeneca in the over 60s remains much higher than the risk of this particularly rare but sometimes serious syndrome. And so people over 60 should still be rolling up to their GP or wherever they are getting their AstraZeneca vaccine and get that first dose. The second important component of the advice is that anyone who has had a first dose of AstraZeneca without problem should feel very confident to have their second dose, and they should keep that booking. Go and talk to your GP about it if you're concerned, but on the basis of information we have in Australia, we've not had a single case of this particular syndrome in a second dose, but we have not had many second doses in Australia. But in the UK, they've had almost 16 million second doses of AstraZeneca, and the rate of this particular rare but sometimes serious condition is much, much lower, around 1.5 per million, which is way lower than the first dose that's across all age groups. So that's the first point is we've changed the data, changed the information. The information has changed, the medical advice has changed. We've taken the medical advice. For those aged between 40 and 59 now, Pfizer will be made available. For people over 60, should not hesitate and get that dose of AstraZeneca. If you've had the first dose, make sure you get your second dose. My father had AstraZeneca last week, and I'll be advising him to go ahead and get that second dose. As other relatives and friends of mine, I'll be making that advice in that age group. For those who may have had AstraZeneca in the past month who are in that age group, 50 to 59, I can imagine that this news could cause concern. Remember, this remains a very rare but sometimes serious event. We're picking it up much more commonly than other countries because we're looking more fully. We've got good diagnostic algorithms and very good treatment modalities and understanding in the clinical community about the correct treatment which is being given properly, and our results really reflect that, so that we have 55% of those 60 cases now have left hospital already. Some remain in hospital and some are in ICU. We've had, unfortunately and very tragically, those 2 deaths in that group. But for most people, they've been diagnosed early. There is a large proportion of those with a less severe form of this rare syndrome, and most of those have been discharged from hospital already.